in this YouTube. So let us start our YouTube session. Of course, it is summertime and there are few important remedies that they should remember in summers. Most of us remember most of the remedies, like we have remedies like nitrums and we have pulsatilla and glonine, lacasis, antimicrobe. These are well-known remedies in summer. So as the people join in and early, I'll just discuss some of the summer remedies and then we can start our question answer session if you have us questions on. So we have lots of remedies. For example, a very important remedy that you should remember, that nitroglycerin is there, that is glonine. In glonine, it is very important to understand, it is basically Dr. Wilmans. Yeah, good morning, good afternoon. So in glonine, it is very important to understand the remedy first. It is definitely a remedy for heat and sunstroke and all, but when to prescribe glonine is such important thing, A glonine personality is very having a nervous temperament, sensitive woman and persons who are readily affected. And that's why it is said nervous temperament personalities. Glonine with lot of cerebral congestion. There is so much congestion, the patient feels as if the head will burst. There is so much congestion in a glonine patient. He feels that the brain is so large and the brain is bursting so much, and he feels as if all the blood has come into the brain. Every moment, every jar, every step basically causes this bursting headache, and it is a remedy for intense congestion of brain, or you can say a suppressed menses. This is a very, very important indication of glonine with violent palpitation, throbbing of the carotids, and rush of blood to the heart and rapidly rush of blood to the head. These symptoms of glonine are very, very important. You have to remember this because in this summer, you will require remedy. Don't always prescribe natrum or natrum carb or antim crude, but glonine also a very, very interesting remedy. You have to differentiate glonine, natrum natrum carb, lacasis, antim crude, so that your prescription is spot on. So I welcome everybody, Dr. Rachel, Anja, Amit, Alexandra, Babel, Dr. Meera. So this is basically what we are talking about glonine. In the same instant, you have to remember remedies like natrum, every remembers. You must remember pulsatilla also. Pulsatilla is a very, very interesting remedy and a very, very important remedy also in cases of sunstroke or elements from heat of the sun. Like nervous temperament is glonine, pulsatilla is adapted to persons who are very indecisive, who are very slow, phlegmatic temperament. This is a pulsatilla temperament that you have to remember. Good afternoon, Dr. Smita. And in pulsatilla, you have to remember the pains are tearing pains, erratic pains, but rapidly shifting from one part to another. That is pulsatilla. Good afternoon, Dr. Daisy. Thirstlessness is also a very, very important symptom of pulsatilla. And so in this summer season, do remember these type of headaches, these type of complaints, so that you are able to differentiate these remedies like pulsatilla, like natrum, natrum, carb, and glonine. Okay. So yes, Tony, hello, good afternoon. This is something about this summer season. And of course, no need to tell about natramur. Natramur is such a remedy, I think everybody knows natramur and its relation to the sun. But as I said, glonine nervous temperament, pulsatilla phlegmatic temperament, and then natramur. It is basically for the anemics and cachetic from loss of vital fluids, whether menstrual fluid or seminal fluid or mental affections. That is natramur. And of course, in natramur, it is basically written that aggression from sun or all symptoms because of sun, the patient cannot bear the sun. After sun, the patient has intense headache of school-going girls, and you have seen where headache is so much that the patient headache is in school-going, or headache from sunrise to sunset, left-sided clavus bursting with red face, nausea, vomiting. Now everything is a natramur. Nausea is there, vomiting is there, redness of face is there. And the patient feels as if thousands of hammer are hammering or knocking at the brain. But the modality of natremur is very important. Amelioration by perspiration, sweating. This is a very, very important symptom of natremur. So I was just discussing, there were a lot of questions on the WhatsApp group about which medicine to give during sunstroke or which medicine to be used in summer. So I was just trying to differentiate these remedies, okay? How to enter the case, or what will be approach of treating varicose vein? See, varicose vein, remember that varicose vein basically is a condition where there is accumulation of blood, and because of that there is swelling of the veins. The problem is when the patient has legs which are hanging down or going against the gravity, there are no wall systems in our veins, no, so the blood cannot come up. So before starting a treatment, tell the patient the varicose vein is in the calf or the legs, that put the legs straight. Very, very important. This is a very, very important symptom, that put the legs straight, and while working at least wear stockings, so that there is always a support to the veins and the vein does not come out, because the problem starts when the varicose vein becomes ulceration is there, then a lot of ulceration discharges, then the problem is that you have to operate the case and take out the vein. Varicose vein, if you have seen, there are some remedies which are very, very precise and which are very, very what you call specifically indicated, like Hahnemann is there, arnica is there, calcarea is there, belladonna is there, carboveg is there, fluoric acid is there. But then you have to understand and see, define that varicose vein. I think I've taken this in the last YouTube. How is the varicose vein? It is painful, it is painless. How is the pain? It is soreness pain, shooting pain, stinging pain, lot of congestion is there. Patient बोलता है कि मुझे बहुत ठंडन लगता है. There is a lot of congestion. Then the remedy would be millefolium. Or you can see a network of veins, In network of veins, you have to think about remedies like Crotalus horrides, lachesis, causticum, calcarea. If it is very painful, then you have to think about Hamamelis, pulsatilla, bromium, and causticum. Then differentiating between the pains, there are different pains, stitching pain and stitching pain, shooting pain, soreness pain. These are all important symptoms to ask the patient and then enter the case. Still, I have found very useful few remedies which are very, very useful if you don't understand the case. For example, if the veins are red, if the patient has standing job, cannot change the job, cannot do anything, but still suffers from varicose vein, then you must think about 3-4 remedies which will work. Sickle core, Hamamelis, pulsatilla, and arnica. These are very, very basic remedies basically that you have to understand and read and then prescribe. Of course, then the veins become sometimes purple, then there is a lot of swelling around the veins. So the remedy differs upon the symptoms. So you have to go back to the Mathematics and see. Now there is one remedy, which is very important, and it is a beautiful symptom written in a Mathematics and repertory. The varicose vein are so swollen, it is like a whipcord. It's like a whipcord, and the remedy is calcarea hypophosphorica. Do read this remedy, calcarea hypophosphorica, because it is like a whipcord. मतलब जो विप रहता है उसके समान उसकी पूरी वेन दिख जाती है. And the remedy is calcarea hypophos, and I have used this remedy in some condition, and it has definitely given me good results. If you study calcarea hypophos, now see, calcarea hypophos basically is the hypophosphate of calcium, and basically indicated in persons having who become very pale, weak, and there is a lot of sweating, emaciation, extreme weakness. Those are basically personalities of calcarea hypophos. And one thing you have to remember in calcarea hypophosphorica, that the patient has habitually cold extremities. Whenever you touch the extremities of a calcarea hypophos patient, it is habitually cold. Now this is a very, very important indication of calcarea hypophos, that it is habitually cold extremities. I have seen in many of patients when I have prescribed calcarea phosphorica. So it was a rare remedy, a very rare symptom, and a very, very rare symptoms of the extremity. So you remember these symptoms and you can definitely have good results with that. Okay. Do you mean glonine? Yeah, glonine. Dr. Smith, glonine. Walaikum salam, Dr. Hussain. Tumor upon the upper jaw and palate, with tumor of the breast, right breast, swelling and discharging watery blood, thirstless, very sweet character. Okay, so if you have already if you have already decided that the patient is having a very sweet character, and if that part is taken care of, now the other symptom is that it is affection of the upper jaw and the right right breast. So just if you just see the if you see Mater Medica, and remember some remedies of the upper jaw, right sided, and the patient mild, gentle, whatever you think of. So some remedies are very very useful that you have to understand in your Mater Medica. No, I don't know about the repertory part of it, because there are lots and lots of remedies. Now whenever you have a problem with the upper jaw and cancerous affection of the tumors of the affect jaw, right sided, sweet nature, see, in this case, of course, sweet nature is very important to know, but the body is trying to show you syphilitic symptom in the jaw area. So your basically understanding should be the syphilitic part of jaw. And believe me, there are few remedies which have given me very, very good results. The first remedy that you should think about in the cancerous affection of the jaw or anything related to jaw, if you're not getting the case properly, you must think about a very, very important remedy, that is Hecla lava. Hecla lava, Hecla-lava. Hecla lava is a very, very important remedy for these type of complaints. And if you have seen Hecla lava, it is written that a remedy for facial neuralgia. The glands are very hard, swollen glands, and in Hecla lava, it is related to the jaw. It's a very, very interesting remedy for jaw. It is written that exostosis of the jaw, necrosis of the bone, that is Hecla lava. And you have to understand Hecla lava, because it will, I don't know if you have used Hecla lava in your practice, but I have used many of times with very, very good results. In fact, whenever there is, facial neuralgia from caries of teeth or from extraction, when you extract the bone, they extract the wisdom teeth, and that facial neuralgia is still remaining, Hecla lava is, acha, if you have not gone good results with Hecla lava, that means I think you have not used Hecla lava with LM potency. You start Hecla lava LM potency in repetition, and you will get results, because I have seen very good results with Hecla lava. Now forget Hecla lava. If you don't get results with Hecla lava, you must think about remedies. Fluoric acid. Fluoric acid again is a very, very important remedy for these type of complaints. Third remedy is arsenic alb. Fourth remedy is antim crude. Antim crude again is a very, very good remedy for these type of complaints. So these 3-4 remedy, of course, then you have to do remember the remedy phosphorus. It basically, whenever you say something about jaw, then phosphorus has to come. So phosphorus, Hecla lava, antim crude, arsenic, major remedies. Then you can have a lot of remedies like silicia, like symphytum, like mercury, like rustox, lot of remedies. But these 4-5 remedies are a very, very important indication in these type of complaints. It's a tumor of the breast and the jaw problem. Start LM potency and repetition, because you will require repetition, and LM potency would work better than centesimal potencies. So you do think about these remedies. Okay, so think about either arsenic, antim crude, phosphorus. These would give you good results. If on pressure anywhere in body, person tends to eructation, no particular rubric, yeah. Basically, that is called as arophagia. And arophagia is basically a condition of a mind. So in these cases, it is important to ask the patient the whole history, because it is not related to the body, it is related to mind. Loose cough and rattling. A loose cough, normally we see in cases where there is loose cough, the patient is able to expectorate very easily. In rattling cough, there is a lot of rattling, but the patient might be or might not be able to expectorate the mucus. 21 years, delayed menstruation, dysmenorrhea, abdominal cramps, acne since puberty, pimples, leaves red marks. What will be the remedy? Now, see, whenever you get cases in regarding to puberty, so what happens in puberty? It's a change of life. So the body has to basically adjust with that change. Now, if the body is not able to adjust with that change, the body throws out symptoms. Especially if you have seen cases in puberty where the menses are delayed, there are a lot of acne on the face. There are few remedies which are very, very important and you should think about. First is Kali Brome, second is Pulsatilla, and third you'll be surprised that the remedy is Basilinum. Basilinum, and fourth Calicariaca, and fifth is Graphitis. But these three remedies, Kali Brome, Pulsatilla, Basilinum, Graphitis, and these three remedies are more indicated rather than calcarea and other remedies. So do think about these remedies. Of course, now the list of remedies, there will be a lot of other symptoms, but if you get elements from, in puberty, everything starts from puberty, then you have to think, like for instance, patient in puberty has menses problem, lot of acne, lot of anxiety, lot of irritability, mood swings, then you have to take the constitutional symptoms like elements from puberty, and the patient says, since I got my menses I have not been well, then you have to think symptoms like remedies like ferrum metallicum, phosphorus, again pulsatilla, lachesis, and brattacarp. So these are the remedies which you have to take when the whole constitution involved, especially puberty in girls. You understand? Hello, Dr. Dhruva. So I hope first you have given. So in these cases, in case of puberty, this is what basically approach should be, not just giving only remedies to bring the menses. The whole constitution is involved. So that's why it is important to take the elements from more than these complaints. And if you have seen, Doctor, if I could add some of the medicines, Dr. Alexandra, there are some medicines again which I have used very sparingly, but with good results. Apart from the basic medicines I told, that you have to write down in your Mathematica creosote. Creosote is again a very, very important remedy when there is a problem in the jaw and there is necrosis or there is exostosis and the right vessel involved. Creosote, rarely indicated, but a very, very important remedy. First. Second, you must always also remember one remedy that is again a very good remedy, but because your case was a very sweet patient, that's why I didn't tell you. The remedy is nitric acid. Remedy is nitric acid. And one remedy that you should always think about, if the lower jaw is involved, whenever the lower jaw is involved, you must think about carboveg and bryonia. Though appears very simple remedy, but very, very important if the lower jaw is involved more than the upper jaw. Okay. Yeah, I hope you got the answer, and I'm a bit fast in answering so that we can cover other questions also. Yes, any other question? Or I'll say some of the, I'll start with some of the questions on the WhatsApp. Like for instance, when what happens if you go and search the repertory and there is there are a lot of other remedies. If yeah, no, nitric acid is not a sweet person to explain, because in syphilitic nitric acid becomes very revengeful, and also it's not basically a sweet remedy. That's why I didn't tell that remedy. But I was just telling because you have specifically mentioned sweet. So nitric acid basically does not cover that sweet part, because in syphilitic phase, nitric acid becomes very vindictive, very malicious, and very revengeful. So we can't have that in nitric acid. But see, in nitric acid, you have to remember one thing very important. In nitric acid, elements from is very important. Elements from insult or offenses. A nitric acid patient does not forget that insult and offenses. That's how a nitric acid starts. And secondly, a nitric acid patient, you have to, if you see nitric acid as a remedy, so nitric acid basically from childhood, is sometimes a remedy indicated when there is elements from admonition. Elements from admonition is also a very, very important remedy for nitric acid. And when he grows up in life, he becomes so angry personality. Even anger from caressing is nitric acid. Or there is so much anger inside the patient, and there is anger with trembling. And the patient is angry and so much that anger on trifles, everything makes him angry. And because of that, there is a lot of anguish. And a nitric acid patient has a lot of anguish because of his loss of his dear friend. Now, it's not always a friend. A nitric acid has a lot of anguish if he has lost somebody whom he is very emotionally attached. He shares his experience, and suddenly that is cut off, and then nitric acid starts. So in nitric acid, these symptoms are so important, and because of this, the nitric acid patient also becomes very restless. Very rare. If you see the mater medica, restlessness. He wakes up in the morning and he is very restless. In fact, I had a case of the patient was so much restless, okay, from midnight to 4 a.m. the patient was restless. And we think about arsenic and kali nitricum and kalika, but this is also nitric acid. So these are different permutation and variations about nitric acid that I wanted to discuss. He's not a sweet person. X-ray. X-ray actually I have already spoken on my YouTube channel. So do go and read that X-ray part, what I have seen in my practice, So if you feel that I should tell something about X-ray, I will tell in next YouTube, okay? Sir, pimples, flat, occasional blood discharge, itching, non-cystic, not purulent, but always with black discoloration, aggravation during menses, no scarring. See what happens in case of acnes, especially you have written into girls and men, related to menses. What will happen, acnes have a very strong relationship to menses. And lot of cases you will see that in case of females or ladies, it is most of the time related to menses. So before, during and after. So if it is very, very peculiar, then take a normal symptom. Otherwise, see, every time you'll land up in only 3-4 remedies and you'll miss the case. Now, if you have seen cases where you have written that the acne in girls and menses, during menses it is aggravated. So if you see these complaints, there are few remedies which are very, very important. No? Whatever I can recollect from my mater medica, calibrome during menses, medorinum, sanguinaria, and whenever the menses are scanty and the patient starts getting pimples, then the remedy is sanguinaria. Now your case basically, it is like bleeding from the pimples and all, and that does not leave the mark. You must think about remedies: carbovege, causticum, calcarea silicata, and rustox. Skin pain in chest, left side, but after exam clinical found that pain is periosteum of chest. Patient tried ruta but no effect. Pain by pressure on local part. How to enter the case? Now, if it is only basically pain in the periosteum of the chest, if it is the ribs. So whenever there's a problem in the ribs, you do think about few remedies. The first you should think about is ranunculus bulbosus. If it is basically ribs, it's very, very important that you understand first pain in the ribs basically. Now, if you have asked me a question, pain in the rib, now I can ask you remedies. I can tell remedies like phosphorus is there, ranunculus is there, silicia is there, thuja is there, rustox is there, and all the remedies of that ribs. But then you have to differentiate whether the pain is basically on inspiration, or whether the pain is basically aggravated from turning the head, or whether the pain is between the intercostal muscle, or whether the pain is basically in which ribs, third rib, fourth rib, fifth rib, or the floating rib. Try to get out these symptoms, define your symptoms so well that you basically have one or two rubrics very peculiar to the case and then prescribe. Just getting that pain in the ribs would basically give you so many remedies, difficult to then prescribe. So get that symptom very right. For example, I had a case where the patient told me that when I press the ribs, I press it is painful. So I gave the patient simple remedy, sternum metallicum. If you see that the ribs are painful on pressure, sternum metallicum, lycopodium, ruta, argentum metallicum, and belladonna. Then go deep inside, how much pain, where is the pain, which rib is the pain, which type is the pain, and then you will be able to prescribe the remedies. No, specific, I'll just give one answer of Dr. Gupta. Specific is basically, see, if you want to prescribe specific, then for all the complaints of bones, we can come up to a few remedies like ruta, symphytum, bellispur, calcarea phos, calcarea carb. They might give symptomatic relief, but curing a case would be getting out that miasmatic symptom of the patient and then prescribing so that you are able to cure the case. Specifics might give you some results till sometimes. No, I have never tried the Banerjee protocol, so I can't answer that. Psoriasis appears with menarche. Sir, please suggest we should go for constitutional medicine or specific. No. Psoriasis basically, as I've always told in my webinars, is always a problem. Basically, it's not an autoimmune disorder. No, it's in the mind. So unless you get the whole history, that's what I have taken. I have got lot of patients of psoriasis. Only by taking the whole constitutional history and then prescribing. I have never given specific remedies like kali iode and arsenic album or the sorelia and all. I've never used those remedies basically specific for psoriasis. A diabetic person age 60 years, difficulty in erection, what will be the remedy? Now, if a diabetic patient is there and you feel that there's a problem with erection, is quite normal. So if you basically are prescribing only on this symptom, then you have then you have very few remedies. Impotency because of diabetes. And if you say impotency because of diabetes, then the first remedy should be anybody? Impotency because of diabetes. Now, specific symptom, specific answers. Can anybody answer the question? So the first remedy you should think about is, of course, the first remedy is acid phos. Acid phos is a very, very important remedy where the patient has impotency, or whether or the patient basically is diabetic and the erection is wanting. Then you must think about, I normally think about first phosphoric acid, second think about helonius, third think about moscus. These are the remedies which I have used in my practice and I have got very good results. But then you have to decide whether to continue these medicines or think of something else, because in diabetes, if you are using this remedy like phosphoric acid or helonius or moscus, it will act only temporarily, because the basic cause of diabetes, there is neuropathy. Because of this, there's a problem. So try to treat that cause of diabetes. Try to treat diabetes in such a manner that the patient is on homeopathic medicines and the sugar is basically maintained with the medicines. So automatically the erection problem, the impotency problem will be solved. Salam alaikum salam, Dr. Alam. Which should be to take care where patient gets dreams of naked or scanty clothes in public place and trying to hide? How to interpret? No, a very, very, very fantastic question, Dr. Vishaka. Now, what happens every time, every time you basically cannot get a rubric. I had a similar case with a similar dream. And I had taken that case because the patient was, the mentality of the patient, I interpreted that he had a problem where he used to always feel, हिंदी में मतलब पता है पेशेंट क्या बोलता है, डॉक्टर साहब मुझे लगता है कि मेरी इज्जत ना खराब हो जाए, सबके सामने मैं नंगा ना हो जाऊं. Because he had that one black chapter in his life, that he used to always fear that if this chapter is opened in my life, I will be basically naked. So he had that fear. So he had the problem of esteem. He had the problem of that esteem, and because of that, he always had that type of dream. And we entered the case from this egotism, and we got a very good result. I hope you understand this problem, this answer. It's a very interesting. It's a very good question, because I think a lot of doctors might have got this dream of naked. Sometimes you get dreams of falling, and that gives the same interpretation. Singh Saab, eyes burning, dryness, photophobia, scale itching with hair fall, worse by head, bloating after eating, flatulence, worse, aggravation morning, blind piles with burning, worse after stools. Now, see, whatever you have given in your case, whenever if you are coming a case in this world of lot of computer, and this lot of people have dryness of the eyes. So if you're only prescribing for dryness of the eyes, make sure that the patient is not glued to the computer, to the laptop, to the mobile, because of it, because you will see a lot of patients having dryness, and a lot of ophthalmologists giving the patients refresh tears drops, just tear drops. But as you have given 3-4 symptoms, so whatever I can repetize manually and see with the symptoms, 3-4 remedies are very, very important. The first, of course, is lycopodium. Second is arsenic album. Third is pulsatilla. And the fourth remedy you should think about is sulfur. One of the 4 remedies, differentiate hot and different thermals, and go to Allen's keynote, and then ask some symptoms to the patient, and then differentiate remedy and give the remedy. Mishra ji, good afternoon. Yeah, Dr. Vishaka. So this is the approach which I basically have in my case. I hope I think I'm very fast, but the questions are so many, so that I have to keep on also remembering whatever mathematics is there in my mind, then tell you the answer. So if you don't understand, you can always repeat, and I'll again repeat the answer. Okay. Dr. Joshi, recurrent pustulas, tie, multiple, having history of rheumatism, not better with Staphylococcus aureus, pulsatilla, cilicia. See, he is not better with this remedy because you have basically tried to only prescribe through sty. Now, of course, their sty basically is a very common symptom in these remedies, but it is not only these remedies. If you open like this, there are lot many remedies. But now rheumatism, there is, if you have not considered that part of rheumatism, that is it rheumatism, is it osteoarthritis, is pain in the extremities, it is so this is very important to understand that if you are treating rheumatism, then you have to cover the whole case. Of course, Staphylococcus aureus is there, pulsatilla is there, but in your case, if it is rheumatism and sty, both, whatever I can repetize, three remedies are very, very important. That maybe you have psoriatic rheumatism, that is psoriatic arthritis. So psoriatic arthritis and sty. Now sty is a pseudo-psychotic condition, and psoriatic arthritis is out and out syphilitic condition, because the psoriasis has got inside the bone and causing destruction of bone. So you have to take into account the syphilitic symptoms. You have to prescribe from the syphilitic miasm, because the patient, the body is throwing out a full-blown syphilitic condition. So in syphilitic condition, in psoriatic arthritis with sty, 3-4 remedies that come to my mind right now. The first is Merxol. Merxol, you have to think about Merxol. That is syphilitic. Psoriatic arthritis. Second remedy that you should think about is Thuja. Third remedy you should think about is Sorainum. And the fourth remedy you should think about is phosphoric acid. And if you open your Matermedica and see sty and psoriatic arthritis, in fact, Merxol also covers sty, Thuja also covers sty, phosphoric acid also covers sty, and Sorainum also covers sty. And all these 4 remedies also covers the psoriatic arthritis. But believe me, because the psoriasis has been suppressed and the patient is going into arthritis, do take the case taking from Sora. It is very important to understand what was the Sora and why the Sora has traveled from psychosis and now from psychosis to syphilis. Unless you get the chain of miasm, why the disease has traveled, you will not be able to prescribe the remedy. But as you have said 2-3 symptoms, immediately that comes to my mind is these 4 remedies. Do study about Merxol, do study about Thuja, phosphoric acid, and Sorainum, and I think you should be able to crack the case. At least that psoriatic arthritis pain has to be reduced. It's a very crippling disease. The patient is not able to walk also. So that's very important. Autistic boy not speaking, only vocal sounds, loves to play in water, will jump in water if he sees a puddle in ground, restless, keeps on running, loves climbing and never gets injured, and got potty trained in week, loves caressing and tickling. Yeah, in autistic complaints, Dr. Alexandra, whatever I have seen in my practice, I cannot claim that I have cured all the cases of autistic complaints, but whatever good results I have got of autistic case, if my colleagues who have joined, who are working with me, if they are hearing, you will be surprised that in last week only we got 4 cases of autism. So it's very clear in my mind. In autistic cases, do remember one thing, the history during pregnancy. There is a phase in pregnancy where patient will tell you that everything went normal. There was no problem in my pregnancy. My husband was good. My family members were, everything was good. But still, how is the child autistic? I have seen in cases of autistic, whenever a lady goes through a mood swing, and whenever that lady has a very dull part in her life, wherever the mood is very bad, wherever she lacks motivation, a phase comes, when that in that pregnancy, that asks that part in that patient. And yes, that part where the mood has gone down, there was no motivation, there was no happiness, and there was no calmness in mind, maybe for a short time, for maybe 1 day or 2, but ask what happened at that time and why was she at this phase of life. because there are a lot of mood changes in pregnancy. That is my observation in case of autistic, Asperger's syndrome, and ADHD. That is very important, that you have to take care of, because the patient will forget it, because she will feel, oh, it was there for only 10-15 days and there was no problem. But those 10-15 days basically has done the problem. So I have not seen remedies like pulsatile or hyperactive and tarantula working. I have seen these remedies where the dull phase correct that part of the lady, that part of the pregnancy, and that will give you the case analysis. 55 years, okay, very syphilitic, as the two older sisters are also delayed. Okay, so you have to ask what did she feel, and then that I had a beautiful case today of in ILD, interstitial lung disease. I have given the remedy, and I'm very, very, very confident the remedy will work. If that remedy works, I'll tell you how did I interpret everything good in the patient. But how do we interpret that case? That is important. So ask the syphilitic part, as you have rightly said, syphilitic part. Yeah, 55 years old woman, cold aggravation, shakes when doesn't eat all the time, blood results okay, exhausted, hourly sweat, pain, joints, nausea, aggravated eating better by warmth covering, sugar, determined exercise, bodybuilding. Actually, I did not get what the question was. Like, old woman, cold, shakes with deposits, eats all the time, blood results okay, exhausted, hourly sweat. Now, if the patient basically is very much exhausted because of perspiration, if the patient is very prostrated and a lot of perspiration, coldness in the bodies, and whatever I can understand from the question, you can write 3-4 drugs which will come basically in your complaints, in your patient. No, sulfur and medoram will not work. First remedy, think of China sulf. Second remedy, you have to think about camphor. Third remedy would be arnica. And the fourth remedy would be phosphorus. Now, these are basic remedies, that will basically help you where there is weakness, perspiration, coldness, and always the patient eats. Of course, there are some rare remedies also where the patient will come and tell you there is a lot of weakness because I perspire too much. Now, if there is weakness because of perspiration, then again you have to think about China, phosphoric acid, calcarea, and jaborandi. What we give for emergency for stone. See, whenever if the patient comes to you with lot of pain and the pain is too much, ask the patient, is there a radiating pain? Is there a burning pain? Is there a biting pain? Or the pain is because the urine has stopped. There's anuria. In this case, 3-4 remedies basically are very, very important, Pruna spinosa, belladonna, Berberis vulgaris, and there is one remedy, basically it is very, very I would say not so much indicated, but I have got good results. That is cannabis sativa. Okay, cerebral atrophy case. Cerebral atrophy case, case of cerebral atrophy, if there are no symptoms, then it is basically sometimes doctors, as they say, it's basically an aging process, So you can give a remedy if there is a problem with cerebral atrophy, there is problem in the extrapyramidal tract or the spinothalamic tract or the ventricles, there is shift in there. But if there is no symptom, just because the patient has been investigated and the patient finds cerebral atrophy, if there are no symptoms, still if you want to treat, you can take the whole case and give the remedy, Yeah, good afternoon, Dr. Ritu. Yeah, Dr. Sharon. See, whatever I have been telling you in the YouTube and in my channels also, YouTube channel also, if you get results, do share your results so that we all learn from everybody. It's not that only I keep sharing. You also share your experiences if you have benefited, especially the COVID-19 no. That is basically what I have been talking about. So if you do have, you can yeah, you can think about Barbarous. No, we basically wanted acute pain. If there's an acute pain, then the patient, if he drinks Barbarous vulgaris with water, he'll vomit. In acute pain, there is a lot of vomiting in case of stones, So in this case, if you give mother tincture in water, the patient might vomit. So just put 2-3 drops of the remedy and the patient should get good results. मिश्रा जी, आपका सवाल हम एक बार लेते हैं. ऑटोइम्यून डिजीज, एंक्लोजिंग स्पॉन्डिलाइटिस, हेरिडिटरी एक्सप्लेन. नाउ देखिए, अगर एंक्लोजिंग स्पॉन्डिलाइटिस है, हेरिडिटरी है, सबसे पहले तो क्या करिए मिश्रा जी कि उसका एक बार हिस्ट्री पूछ लीजिए, और क्या करिए कि उसका एक थोड़ा टोटलिटी बनाइए 3-4 सिम्टम का, लेकिन वो सिम्टम होना चाहिए सिफिलिटिक, बिकॉज हम सिफिलिटिक देख रहे हैं. और उसके बाद उसके सिम्टम्स और उसके हेरिडिटरी सिम्टम्स को अलग कीजिए, एंड देन उसके बाद क्या करिए, उसके बाद उसको रेमेडी दीजिए. अभी एंक्लोजिंग स्पॉन्डिलाइटिस के लिए कुछ स्पेसिफिक रेमेडी से बड़ा काम नहीं करती है. अगर आपने कॉन्स्टेंट रेमेडी दिया तो उसमें क्या होगा, पेशेंट का प्रोग्रेस हम रोक देंगे और पेशेंट एक नॉर्मल लाइफ जी पाएगा थोड़ी तकलीफ सहन करने के बाद. Impotency. Now what will I tell about impotency? Impotency, then see, there are a lot of remedies for impotency, and there are a lot of approaches in treating impotency. Impotency, again, agar aap, Amit, if you want to treat impotency, then again you have to basically define that impotency. I'll tell you, for example, impotency chronic. Patient comes in your clinic and says, I have a problem of erection, I have problem ED since it's been a long time, I have no desire. Okay, give him lycopodium. Chronic impotency. Impotency because of diabetes, we have Helonius, we have Muscus, we have phosphoric acid, lot of 3-4 remedies. Now there are conditions where the patient comes impotency during sex. Now, it's a very vague symptom, but I had few cases where the patient says that during sex he had impotency, camphor, fluoric acid. The patient comes to you impotency after gonorrhea. Then you have to think the first remedy is thuja. The patient comes to you and tells you, I have very lascivious thoughts, lascivious fancies, but impotency, selenium. Or the patient comes and tells you, because of impotency, I am getting memory loss. I cannot think properly. I cannot write. I cannot recollect. Calibrome. Or we have impotency from masturbation. Then don't always think about phosphoric acid. Think about gelsemium. Think about califos. And think about argentum nitricum. Or a very, very common problem, impotency because of nervous prostration. Then the remedy would be Turnera diffusa. Very, very, very important remedy. Very, very important remedy. Or the patient comes and tells you that because of this, that, because of this is not happening, that is not happening, there's a lot of sadness in life, and then impotency. Then I have told elements from business embarrassment, disappointment, disappointed love, reputation problem. Which is that remedy? Calibrome. So this is all important. Impotency because of this problem. So impotency because of sadness. Calibrome, gelsemium, caladium. Very, very important. So it is, or some patients come and tell you, Dr. Sahab, everything was nice since 2 days. No? Since 2 days, there is impotency. Then the remedy becomes fluoric acid. So this is how you have to again analyze the symptom, get to the depth of the patient symptoms, and then you'll be able to prescribe. Otherwise, if you open impotency chapter in any therapeutics and all, there will be hundreds of remedies. And then you'll be confused what to do. So differentiate those symptoms, it will be easier for you to prescribe. I hope, Dr. Amit, you got the answer. Cranky children, very irritable, 5 years, his mother hits the mother, does not go to toilet every time, shouts, screams, recurrent cough and cold. See, this is a problem. I think, Dr. George, if I can elaborate this question again, is this the only child in the family? And the child is very loved and pampered, and she knows that whatever I do, whatever I want, I always get from my family. That's why always irritable, does not want to go to the toilet, does the toilet in panties only, and because she's not able to go out of the family, that inner circle, she whenever she goes for a challenge like mental or physical, or she goes for swimming, she gets cough and cold. She goes out in the sun, she gets sunstroke. She goes out and eats something food, she gets diarrhea, dysentery. Because the child is so pampered, and the child, that's why is not seen the world mentally and physically. So you have to go from the rubric spoiled or pampered child. So Dr. George, if you can elaborate, is that the problem? And if that's the problem, then you have to think about remedies, which I told you before, either lycopodium or sulfur or brata or ammonium carb or moscus, anything should work. Of course, in the acute complaints, treat the acute complaints first, Dr. George, and then if the patient is normal, then take the whole case and then go for the similimum, so it will work. If you give the similimum acute complaint, like the patient has got sunstroke and you're giving the similimum lycopodium, it may not work. Give the acute complaint because the body is throwing out symptom, the body wants a sunstroke remedy, and then after health, take the case, the pampered child or the spoiled child, then you can prescribe the remedy. Of course, this is what I am thinking, Dr. George, with your questions of 4 lines, whatever I can read in between the lines, I'm answering the question. Dr. Amit, I hope, yeah, you got the answer of importance. Very nice. Good. Vitiligo after suppression of anger, patient doing supervisor job, constant under pressure of boss, but not express anger against him, no brooding, no. Yeah, see, simple one-sided disease, vitiligo, syphilitic, destruction. Simple, by suppressing the anger, you will not get vitiligo. Now, anger suppressed, it gives rise to a very, very important state of the mind. The patient is in a state of, you know what, anguish. The patient is in a state of so much anguish. The mind is so painful that he is not able to get out of that situation. The anguishness, which is syphilitic, will give rise to this. So ask that, how is the reaction? How is the reaction? And then you will be able to prescribe the remedy. Suppressed anger, see, if you open the rubric, there are lots and lots of remedies. But anguish, this is anguish, mental pain. And because of every day the same thing, every day the same thing, and that's why the patient lands up in these complaints. I hope you got the answer, because see, vitiligo is a very, very important disease, because what will happen, otherwise it will spoil the life of the patient. So your case taking has to be very good. Okay, so I hope you got the answer. Used constipation in a child passes the stool only in standing. Okay, so see, child passes stool standing. If you open the repertory, there are only 2 remedies, of course. One is alumin and the second is causticum. I know. So if this was the case, then do ask the patient whether he had this problem since birth. So if a newborn is having constipation, and now the child is following same, you must think about one remedy, that is opium first. Second, think about calcarea carb. Third, think about simple Nux-Vomica. But if I was given the case, if alumina and causticum has not worked, do give in LM potency. If you have LM potency, you have to differentiate opium, calcarea carb, and Nux-Vomica. Ask the patient whether it's in newborn, because if the patient is already bottle feeding baby, remember, if the patient is fed with artificial food and then the patient gets constipation, causticum will not work, Nux-Vomica might not work. But in this case, if it is fed with artificial food, do think about podophyllum, then opium, and then Nux-Vomica. I hope you got some answers. Patient change job, now feels better, happy with it. But yeah, so patient is changing the job. Of course, the stress, the anguish basically has already created that syphilitic change in the body. So make sure that you take that case and understand the emotion of the patient. Dr. Joshi, in this case, the patient will be able to tell you a very specific delusion, कि मुझे ऐसा लगता था कि मेरे बॉस मेरे आंख पे आके बैठ जाता था, whenever मुझे ऐसा लगता था कि मैं घर भी जा रहा हूँ ना, मेरे बॉस पीछे पीछे आ रहा है. मुझे ऐसा लगता था कि बॉस सोचता है कि मैं एक क्रिमिनल हूँ, मेरे पीछे पीछे लगे हुए. He will be able to tell you some beautiful delusions, because he's so much involved. He's so much involved in that case, in that thought of suppression of anger, and that will give rise to some syphilitic symptoms on the sensorium that you have to catch. Okay, this is basically 4 or 5, so it is in children's. So in children, of course, do think about the artificial fed babies. In children's, if you get constipation, first drug Naxomica, second drug Calcarea, third drug Podophyllum, and one of the important drugs which I have used in my practice is golden seal. Do think about golden seal also. Of course, there are so many remedies. So these 4 remedies are very, very common. And fifth remedy, again rare, which I have used is Alumen. Alumea. It's not alumina, it is Alumen. Patient 10 days of Nephilim 30, right side sciatic is relieved, but backache is still there. Should I Colossian 2 and 6? No, Nephilim basically is a very, very specific remedy for that sciatica, So you are basically able to treat the sciatica with Nephilim. So Nephilim has already done the job. Now the patient has backache. So if you're treating in parts, one part is over, backache, see the part of backache, where in the backache, see the modality, see the aggravation, amelioration, and then prescribe remedies. You can think about Esculus or Guaiacum or Symphytum or Kalicarb. These are the remedies. Then you should give the remedy. One case of vitiligo extensive. Yeah, see vitiligo basically, of course, if you ask me also, cases of vitiligo, in lots of cases I have succeeded also, but in some cases I have got failure also. I have not got results. So in vitiligo, whatever I have learned from the organ of medicine, that is BK Sarkar, and what Hahnemann chronic disease has told is basically a one-sided disease. So treat accordingly. Go and read that, and you will maybe able to crack these cases. Deep cracks on soles, painful itchy. So very, very common remedy that you remember. First is petroleum, then calcarea flour, then Merck salt and arsenic, fluoric acid. Lots of remedies. Midnight crime is also relieved. Okay. Strong smell from the armpit. Now, whenever if you are getting, if you're only prescribing just for small offensiveness, sweats in the axilla, don't prescribe that, because see, there are lots and lots of remedies, and you will be only treating that part of the patient. So it might only relieve symptomatically, but still, if you feel that you want the answer only for the armpits, so you can write down some remedies like whatever I understand from this. Whenever there is perspiration, whenever the perspiration is very offensive, you can just write one thing, that the perspiration is fetid, or offensive. If the perspiration is offensive, see, you have so many remedies, but the most important remedy you must think about is sulfur, thuja, nitric acid, mercury, carbon sulfur, and carboanimalis. Patient aged 25 years, motion 70 times per day. After eating, he has to rush to water, but stool is normal for more than 6. No, the patient, I think, is more than fatty liver. The patient is suffering from, I think, irritable bowel syndrome. And if irritable bowel syndrome is there, so as I always say, you must be able to prescribe only by taking the whole case, because the patient will keep on telling you symptoms like stools are like watery, stools are reddish, stools are blackish and all. If you go on prescribing the symptoms, basically you will not be able to cure the case. In this, maybe it's an IBS case or colitis case, take the whole case before prescribing. Okay, just one set perspiration. Then you have to think about remedies: Naxomica, petroleum, thuja, ambragrasia, and bratacarb. One set perspiration: Naxomica, petroleum, thuja, ambragrasia, and bratacarb. Yes, totally should be indicated, properly said, sir. Okay. So I think it's already 3:57. I can have one question and before I close. Okay, Mishra ji, आपका एक सवाल है. Bad breath come from the mouth without pyorrhea. Remedy please. अगर मुंह से बहुत अच्छी मतलब बदबू आ रही है, sometimes what happens, what do you call, there is a lot of fermentation, there's a lot of fermentation in body. You can think about remedies like carbohydrates, lycopodium, china, tobacco, oxalic acid. These are remedies where there's a lot of ferment, naxomica, raphanus. So we have bad breath because of ferment. There are a lot of causes of bad breath. Okay, melasma over the nose. अब ये मेलेस्मा जो बीमारी है ना, मैं खुद बोलता हूँ कि बहुत डिफिकल्ट है ट्रीट करने के लिए. डेफिनेटली एक बात बोल सकते हैं हम कि इसका हम कलर दवाई से तुरंत हम कम लाइट कर सकते, बट इसके अंदर प्रिस्क्रिप्शन बहुत इंपॉर्टेंट है. उसमें क्या होता है कि आपको रेमेडी सोचना है, वो है सीपिया, लैकेसिस, ब्राटाकार, कार्बन सल्फ एंड कालीबाइक्रोम, और सॉरी कालिकार. ये रेमेडीज आपको सोचना है. One more question do we have? Thank you. So I think we are there for the umbilical hernia 3 months old child. Umbilical hernia 3 months old child, do take the case history, but whatever results I've got good results with lycopodium. I've got good results with sepia, naxomic and calcarea carb. So everybody, thank you so much for joining. Meet you for the next YouTube live. Meantime, if somebody had asked question about X-ray, go on my YouTube channel, Dr. Abdequaem's Grace Healing Homeopathy. Here X-ray, if you still feel you need something, I'll tell you in the next YouTube live. Thank you so much.